Hi, this is Dr. Maria Hopp at the Littleton Clinic. I'd like to talk with you today about functional medicine. Functional medicine is different than conventional medicine. With conventional medicine, the illness is diagnosed and treated with medication. With functional medicine, there's more of a recognition that multiple factors underlie a single disease. For instance, think about how high blood pressure is caused by a bad diet, lack of exercise, genetics, and other things. To treat the condition, all the causes need to be addressed. Functional medicine also recognizes that a single factor can result in multiple symptoms. Today, I want to talk about a very important single factor that quite possibly could be having significant ill effects on your health. Then I will make some simple suggestions of things that you can do about it to improve your health right now. That single factor is stress. Stress is when our perceived demands, the demands on us, and our ability to cope are mismatched. How do we know when you have stress? Think about it. You feel tired, but tense, you can't sleep. So how can we be so tired we can't sleep? Those are good signs that people are under stress. It's one of the most common things that cause fatigue. What's happening when you're stressed is that there's a lot of hormonal signals that are going on in our body. There's some cortisol that's being released. There's some adrenaline that's being released. That's called your sympathetic nervous system. And this is causing all kinds of problems. It's good if it happens just acutely. For instance, like if you're being chased by a bear. But if it happens chronically, then it leads to issues with insulin resistance, increased inflammation, osteoporosis, all kinds of stuff happens. The adrenaline itself causes issues with atrial fibrillation, high blood pressure, and it definitely happens when people are having heart attacks. High cortisol has been linked to issues with dementia, decrease in muscle mass, elevations in blood sugar that lead to diabetes, as well as being overweight. With stress, something happens, we perceive that as difficult, and then our body starts to respond by making that cortisol and adrenaline levels, and that has a significant ill effect on our health. But what if you could change the way that you perceive things? So think about things differently, right? These are some things that we could do right this very minute that might make a difference with our stress levels. Go outside and exercise. Google guided imagery. It's an awesome thing to decrease your stress. Meditate. That could be as simple as breathing in for 4 seconds, holding your breath for 4 seconds, and then breathing out for 4 seconds. Use some biofeedback here. A lot of people have Fitbits. There's a nice relaxation mode on the Fitbit that's biofeedback. Say a prayer. Think about something that you're grateful for. Think about what's going right today. Forgive somebody. Don't make assumptions. One of the things that makes people happy is if they can presume that other people aren't being bad to them, that they're really just doing the best that they can. Think about that. Nobody's trying to get you. They're doing the best that they can. Get more sleep. Don't drink too much caffeine. Talk from the heart. Reach out to a friend. And sometimes if that doesn't help, there are some nutraceuticals that might be useful. Say a mantra. A mantra is just a word or a chant that we repeat over and over again that helps us to cultivate peace in our heart and in our life. These are some ones that people use. You can try one of these or think of one yourself. And remember that it's always better to give than to receive. The people who give have significantly fewer health issues. This is Dr. Maria Hopp. I hope you enjoyed our talk today.